What's up, beautiful people? Another day, another study. Wearing my Parker Seminar shirt because we're heading to NeuroCon today. So if you're going to be in Dallas, I'll see you there. But this was a really interesting randomized controlled trial. It's known that insomnia is causally associated with depression, and there's evidence showing that chronic inflammation is also associated with depression. This study was looking at a possible causal reason for that, and that is chronic inflammation. So, what they did was they took people who were older, who had chronic insomnia, and people who didn't, and they exposed them to endotoxin. And endotoxin is a reliable way of increasing systemic inflammatory markers. And looking at the difference between people who had insomnia and people who didn't on several depressive questionnaires. And what they found was the endotoxin reliably increased inflammatory markers IL-6 and TNF, and it was similar between insomnia and non-insomnia patients. And then compared to placebo, the endotoxin exposure did increase depressive symptoms, and this was a much greater effect was seen in the participants with insomnia on 3 different questionnaires. In fact, on 2 of those questionnaires, the level of the depressive symptoms reached the mild depression range. And in the sensitivity analysis, they confirmed the hypothesis that the increase in depressive symptoms was related to an increase in depressive sensitivity. So that means that it wasn't a difference in the inflammatory marker levels, but more that the people who had insomnia were more sensitive to the inflammatory exposure. So overall, there's a 3-fold greater increase in depressed mood and depressed symptoms in people with insomnia compared to those without. And also the mood alterations persisted for longer than 6 hours in the insomnia participants, and the alterations were transient in people without insomnia. Possible mechanisms for this include alterations in the blood-brain barrier, increased brain glutamate, maybe alterations in expression of circadian clock genes. Really interesting study. There probably will be more studies after this, like longitudinal studies and maybe interventional studies looking at inflammatory markers in these populations. But to me, the key takeaway right now is this is another study showing why it's important to look at markers of chronic inflammation in patients.